to do is start to build up and reassert hospitals' ability to take in a large number of patients. Over the last several decades, hospital care has moved a lot of ways to outpatient care. The number of hospital beds decreased and folks went in and got out on the same day. COVID-19 doesn't work that way. And with the usual input of patients in-bed facilities, a large influx of COVID-19 patients overwhelms the healthcare system. Unfortunately, we've seen that in certain parts of the world, and we're starting to see it here in the United States, especially in New York. What it also did is gives us more time to learn about this disease, to get better data, to update our modeling, and to update plans of attack. So slowing COVID-19 absolutely saves lives. And building up that capacity in the hospitals gives us the time necessary to start moving this further down the road so we get closer to therapeutics that may work. You get better testing like antibody testing, and eventually we get to a vaccine that will save lives. So I want to just be very clear. I know these actions are painful. They're painful both social isolation-wise. They are painful economically to many of you. The stress and the disruption you've been feeling is unprecedented. And I think it's very difficult when we don't see an end to it or we don't have a clear plan together. That's why Minnesota's taken a little different path. And it's why one that I want to make sure, since we're all in this together, that everybody on this team understands what we're seeing, what the data shows, and what the plan of attack going forward is. So on March 25th, I issued Executive Order 2020, which is our stay-at-home order. You're following this. I still encourage people, keep the social distancing, don't let your guard down. As I said last time I addressed you, if we don't have things in place and we don't buy the time necessary and we let our guard down on social distancing, this thing will come roaring back. More than likely, it will come back for a second wave, but by that time, the plan is to have things in place to deal with that, to make sure that we treat those that are most ill, and that we have things in place that let us identify who has already had this, who potentially has short-term or long-term immunity, and ways that we can speed up our testing in real time. So during the stay-at-home order, we are collecting that data. I want to share some of that with you. We are increasing the number of ICU beds, ventilators, personal protective equipment for the surge. I'm going to talk about this later. This is not without challenges, and this is not without roadblocks. But our job is not to complain about roadblocks. Our job is to breach those roadblocks or work around them, and that's exactly what we're doing in Minnesota. And then to develop strategies together to address the economic and social impacts, both in our current situation and what happens when we come out of stay-at-home orders and when we try and move back to something that resembles normalcy. So the data that I have in a website that we've created is a one-stop portal, if you will. We are going to continue to update it, but it will provide you the data that we are seeing that is informing us about how many gloves we have, how many masks we have, how many sicknesses we're having, and where are they located. Trying to make sure that as you are part of this plan, you understand what your stay-at-home order means, you understand what preserving PPE means, and you understand when it's time to get to the hospital and what will be done once you get there. So I want to show you and spend just a bit of time on this. This is our COVID dashboard, and once you get to the site, you can see it listed at the top. There is an awful lot of information there. But what it will show you is just on this first front page is the cases that we have, the folks that have recovered, unfortunately the fatalities that we've seen, and of course our entire mission here is to keep that number as low as possible. This site will also allow you, as I said, to be able to go on educational resources, employment issues like unemployment insurance or workman's comp, and different resources about where you can and what you can do during our stay-at-home order. This next slide is one that we will continue to build out. And this is one that's of deep importance to all of us. If you see at the top is the testing, and there'll be time and we'll talk some more about that at a later time. But as Minnesota starts to strategize of what long-term testing would look like and what the purpose of it is, we expect to start creating some of our homegrown ability to expand that. Ways that we can use the serology tests that should be able to help us predict some immunity, getting more folks back into the workforce and more folks back into normal life. Social distancing, just one metric that we have up here, and we're using several on this, is just typical traffic patterns so that you can see this. If we do this and we see that these things correlate directly with compressing that curve and pushing it out, that is allowing us the time to do what you see in the middle there on hospital surge capacity. And if some of this is too small on the screen, I just encourage you all to get on the site after we're done. This will be updated, as I said, daily, so that you can keep an update just as we are. And what you start to see is the ICU beds. And I want to point out in there where we talk about current ICU bed capacity and then 24-hour and 72-hour surge capacity. We're not just building these where they set empty, we're preparing for when the surge comes, which means we can operate as normally as possible in our hospitals, using the staff that we have as wisely as possible, preserving PPE when we need to, and at the same time being able to surge into those beds, both internally in the hospital situation and then alternate care facilities should we need those. And then you look at the ventilators being used, and then the procurement, which I'll talk a little bit in a while as we're starting to procure these essential materials that we're going to need. And then a list of the critical care supplies. And I want to just be candid with you, Minnesota. A lot of folks are not putting out this information because they're afraid it'll create a sense of panic. You can see on here, we need more of these things. We need to continue to get them. We need to have them produced. We need the supply chain to work. It's no secret either that there's somewhat of a disconnect between the federal strategic stockpile and what the states have. My job as governor is to find a way to get these, and that's exactly what we're doing, both internally with our procurement specialists and then externally with some of the best companies in the world helping us do that. And then how we're being able to get this personal protective equipment out to people, and how we are making sure that those, as we expand the need to have this, and I'm hearing you, Minnesota, if you're in a personal care setting, if you're a police officer or firefighter and you're responding to calls, if you're clerking at the grocery store, and I've noticed some have started to put up plexiglass shields and doing that on their own. We need to work together on this because this is an area that's going to make the difference between life and death and protecting our first responders. Our child care capacity, and we've worked incredibly hard there so that first line responders can get out there, making sure their children are taken care of, and making sure that we're able to keep those child care providers safe and open. And then economic security. And I'll talk a little more about that later. You're seeing the numbers, an unprecedented surge in unemployment claims, an unprecedented stress on our economy. And we are taking all of those into consideration as we protect human life and think about smart strategies to quickly and safely move us back so that we're able to go on with the economic activities that matter to us. So I'd like to respond to what we're doing here. And these are the work groups. You are buying us the time. So you have an expectation, if you've given us that time, what is the time buying us? It was buying us that capacity to ramp up those materials you saw, to plan a response to this, to talk about recovery, and then where are the resources coming from? How are we managing state budgets? How are we working with our federal partners? And how are we building public-private partnerships, which I would say, thank you, Minnesotans, once again, for the recovery funds that have been set up, for the smart things that our nonprofits and our for-profit corporations are working together to provide that. The state's job in many of this is to help align that, to make sure that those resources are being funneled in a coherent manner, all aimed at that point of keeping people from getting this. If you get it and need hospitalization, that care will be there for you. Because if that happens, the one thing we know that in this 90 days that we've seen COVID-19 is, we have a much higher success rate of saving people if that's there. If it is not, we start to get where the system crashes. So I want to talk about the working groups and some of the lines of attack and lanes of responsibility that we put on. You saw the hospital surge, partnering with the hospital to assess needs. This is unprecedented. Our hospital systems are independently well-run agencies, but they are internal to themselves. They order their own supplies. They have their own doctors. They have their own protocols on when to use these supplies. What we've been able to do in Minnesota, and this is planning that goes back many years, is to be able to coordinate together, to talk together. The supplies that you saw on the previous slide are supplies that the state stockpile has. Individual hospitals have those, and we're able to see that. We're able to forecast when their burn rate is going through, and the state can restock to them, to making sure that we're moving where the needs are. Understanding that the state is not going to see the same needs at the same time, but when they come, we can move to that. And I have to tell you, that comes to supporting this workforce. That's childcare. That's personal protective equipment. That's understanding that our frontline Especially medical workers are under an incredible amount of stress. Supplies. This is the procurement, I would say again. We put a top procurement officer in charge of that. We are working with some of the best people. I am on the phone multiple times daily with CEOs of corporations where they're able to say, we can get you 83 ventilators today. We're sending 6 over now. Here's the time frame, and we will have you your requested number by your peak surge date. Those are the things that we're working on. And as I said, this system, as you're seeing play out, is strained around the world. We know that certain, because of the supply chains that are in multinational companies, some are not allowing export of those materials, and we need to work around those. My job and the job of my team here is, again, not to just say that there's a roadblock, to work around or breach the roadblock, and we are doing that. Testing, working with hospitals to expand testing, working with the Abbott labs. We're waiting. We were told 2 days ago we would get the Abbott labs, the quick 15-day test. We are still waiting on the 15-minute test. We were supposed to get 15 of those units. We're waiting on those. Those types of things inform our strategy. One of our long-term strategies is working with places like the Mayo Clinic, who's working on serology tests, the antibody tests, is at some point in time, it's hoped that our goal is that we're able to test large numbers of people with the capacity in the state, not relying on anyone else, be able to tell who's immune, and then do the fast rapid tests where we may be able to return certain institutions back to more of normalcy and be able to test on a regular basis, be able to do temperature checks at the door, anything that gives us rapid response, rapid mitigation, rapid isolation while allowing a large number of people to continue to function. Education and childcare, again, we're working hard to make sure our children get the education. I know this is challenging for them. I'm speaking to all of you right now. It breaks my heart. You're missing your classmates, you're missing your teachers, you're missing those things in the spring that are so important. I know there are athletes out there that were prepared to go and win state championships, that were prepared to compete on the fields and on the diamonds across Minnesota. Your sacrifice is keeping people safe. It will not be forgotten, and please know you're setting an example for us. Protecting people. This is that idea of isolating the most vulnerable. We are seeing, like every other state has seen, that the fatality rates of COVID-19 target the elderly and those with underlying conditions more than ever. They can strike at all ages. No one is immune. Healthy young people are getting this and becoming fatalities, but we know that the preponderance of the evidence shows that those congregate care facilities. So we're working incredibly hard on that. I want to thank the Department of Health and folks working together to understand that in unprecedented times, we will protect people's privacy and civil liberties, but if there's a need to get information out of like where these facilities are, you deserve to have information. You deserve to be as well-versed as possible on the facts around COVID-19, the data that we are using to inform our decisions, and then the plan of attack so that you can be part of this. Food security is a deep concern. I just got off the phone with many of our major agriculture groups and agricultural producers. We are still seeing the supply chain is solid. There is food in the grocery stores. There is no need for people to stock up or overstock up. And those producers are already thinking about things like how do they get in the field? How is seed and fertilizer going to be delivered? What will harvest look like and how do we move those? And I remind everyone, our neighbors who are food insecure, we are coordinating closely with our food banks. We have brought on experts in this, Andrew Zimmern, folks at Hormel, folks who understand how this works together to make sure that every single Minnesotan has adequate food through this entire pandemic. And then economic security. With the federal government to help provide for those folks, businesses, individuals who were laid off. And I want to be very clear, the state of Minnesota is doing this as well as any other states in getting out, especially unemployment compensation. But I want to let each and every one of you know how the people at the Department of Employment and Economic Development and how everybody in our administration views this. If we get 99 checks out in a timely manner and deposited in people's account, and we fail to get one out, that one family is so severely impacted, we cannot accept that. And so while it may never be possible to be 100%, the goal in this administration is to do exactly that. And when folks are falling through the cracks, to go back and adjust. Working with our federal partners who delivered the CARES Act is a great start for us to get there and then implementing that. But I want folks out there to know we hear you. We're not going to, and it is no time to say how great we're doing on unemployment insurance if someone's not getting it, how great we're doing if a small business owner has not been there, or if a farm doesn't have the capacity or the capital to be able to buy the seed for spring planting. So we'll continue to work the issue. Our partners in the legislature have been spectacular. I oftentimes talk about One Minnesota and working together. We have healthy differences that create a vibrant discussion around how things should be done. But this group of people rallying around the people of Minnesota, suggesting good ideas with an expectation, and you as Minnesotans can expect this, if the data changes or new situations arise, we will change our course of action. We will change where we're at. We will never allow ideology to get in the way of facts. If the facts don't support the ideology, we're changing the ideology. And I think you're seeing a fairly rapid ability to go back and forth with legislators and our federal partners. We need to ensure funds are available quickly. It is an unprecedented time. If we need to step up security at our corrections institutions, we need to move those resources quickly. The same with when I have the ability and these come up quickly and the chances disappear quickly. If I have the capacity to buy masks or ventilators, I need to do so immediately. And the legislature needs to know that there is a fully transparent way to manage where those funds are going, how the decisions are being made, and reporting back to them. So I want to thank them for both their leadership and their oversight capacity during this unprecedented time. I think it's important, Minnesotans, as you're watching across the country, to not sell false hope where it isn't there. Plans matter, preparations matter, but to understand this is an unprecedented challenge. Challenges are arising, as we said, both from the capacity in our hospital beds. We still are learning about COVID-19. There are promising therapeutics on the horizon. We're hearing different things that are being tested, but it takes time. And those challenges are still because of not having the full picture, the lack of data. And I want to mention, no model is perfect. And you're seeing many of them out there. I'm doing the research too. I'm asking why the one in London looks different than the one in Washington State, that looks different in Minnesota. Our goal is to personalize it as quickly as we could, understanding we have a short data set to go into that, so the parameters and the ability to have a sense of confidence is pretty wide. But the one thing I can tell you, every single model shows replicable trends. We know what happens if we don't get social distancing. We know what happens if you are not able to get ICU care when you need it. Those things are known. So we continue to refine those models. We continue to look at them. We continue to try and make realistic expectations, because I can tell you right now, states that are requesting 10,000 ventilators are not going to get them because they're not there. So we need to figure out, how do we make sure that we're moving what we have around, that we're increasing the capacity to the absolute limit that we can, and that we're being innovative in reducing the numbers or the ability to get people the care they need. So states are competing against states right now. That's no secret either. Countries are competing against other countries. We are doing everything possible to make sure that Minnesotans are taken care of without compromising our ethics to our neighbors across this country and across the globe. There are ways that we can do this if we strategically plan, if we think together, and we think about, once a wave has passed somewhere, I think the expectation is that those states will then be able to help others. So as this goes forward, there are going to be more of these come up, but Minnesotans have taken these on before. We are not simply going to accept that this is what COVID-19 does. There are things that the virus will do, and there's a science that shows us where it's happening, but the science is also on our side of finding things we can do against it. The ability to think coherently, to think together, and to move against this is one of the advantages that we have. So the danger is still here. The numbers, and I want to make sure I tell everyone this, the peak will come to Minnesota. We are still early out. You have made it possible to push it out further, which has gained valuable time. But it will come. It will most likely come before we have a lot of the therapeutics we need, or certainly before we have a vaccine. But when it comes to Minnesota, our intention is to make sure every single one of you gets all of the care that we can possibly provide you, and that we continue to use data to keep us separated long enough to make sure fewer of us get infected. So we've got a lot of work to do yet, Minnesota. We've got a plan that gets us through this time, that prepares us for the peak, and then also looks at being a state that can recover as quickly as possible, both from a health standpoint and from an economic standpoint, to get us driving forward. All of those things happen because this is a state that has built resiliency into its system. It's a state that is well known for our medical expertise and that medical infrastructure. And above all else, this is where character starts to get defined. The ability to say, I will sacrifice in the short run to make sure that my neighbors and my family stay safe. I will follow the rules to make sure that we can get there, and I will continue to keep myself informed so that the spread of misinformation or new ideas that may be getting missed are able to be shared in a coherent manner. So Minnesota, I look forward to talking with you more. I look forward for the side when we're done with COVID-19 and we've learned an awful lot about ourselves on the strength of this state. So as one Minnesota, we'll get through this. Thank you.
That was a live update from Minnesota Governor Tim Walz. It has been almost exactly 1 week since Walz's stay-at-home order went into place. That was at midnight last Saturday, or 11:59 p.m. last Friday. So we've made it through 1 week. The governor just unveiled a new data database that you can go check out, a data dashboard. The website, if you're interested in going and looking at that yourself right now, is mn.gov/COVID-19, and COVID-19 does not have a dash in it. So mn.gov/COVID-19. Wisconsin Governor Tony Eavers will also be providing an update shortly. We'll be back with his statement in just a few minutes. Welcome back. If you are just joining us, we're standing by for an update on Wisconsin's COVID-19 response from Governor Tony Eavers. The pandemic has left millions without jobs, and as food insecurity inevitably increases, Second Harvest Northern Lakes Food Bank says they will be there to offer support, even if it means changing the way they do things. Amy Adamley reports.
Second Harvest Northern Lakes Food Bank, like many other organizations, is adapting to these trying times.
We're kind of running at a frantic pace. Our goal is really then to try to mobilize as many pre-packed food boxes as we can.
With COVID-19 concerns, they've had to make adjustments.
All of our food shelves have changed to a curbside pickup. It's a very safe social distancing measure for distribution, so people should be really confident that we're taking all precautions and so our food shelves to make sure that this service remains safe.
Second Harvest has also adjusted to an impact on supplies.
There has been so much overbuying. There's just not surplus left over for organizations like ours to pick up or benefit from. So we've really seen a lag.
Despite that, they continue to be able to provide support.
We've had to, work with brokers or work with organizations to purchase product, and that becomes a little bit more expensive for us to operate.
As many people remain unemployed without income, Second Harvest is preparing for even more need.
We're hearing from regional food shelves that they've had days where there's just a demand that they're a little overwhelmed by. And certainly now with unemployment, we have to believe that we're going to be seeing more people who are on that fringe of, just now needing food assistance.
And they'll continue to be there to offer that support.
And if you're in need, recently unemployed, certainly that's what these resources are available. So don't be afraid to seek us out if your family is really having a food shortage. We're here and we plan to continue to be here.
I'm Amy Adamley for WDIO News.
Thank you, Amy. And if you're looking to help during this time, Second Harvest is looking for healthy volunteers in small numbers. They say to call the food shelves ahead of time to make sure that there is a need there. We are still standing by for Wisconsin Governor Tony Eavers' update. And while we wait, an update on how Northland hospitals are responding to concerns over the lack of N95 masks. Emily Ness has that report.
We have a running tally of our PPE across the board, different types of masks, different types of gowns, different gloves.
Dr. Nicholas Van Dielen from St. Luke's denies allegations from the Minnesota Nurses Association that the hospital does not have enough personal protective equipment.
In regards to the allegation that we were not prepared or had not prepared for PPE, that's just categorically untrue. We have been prepared. We have adequate stocks of PPE. We have been and continue to aggressively pursue other sources.
Additionally, Van Dielen denies that healthcare providers have had to work without personal protective equipment.
We are not aware of any cases where we have asked or staff has been asked to work without PPE. We would not endorse that as an organization ever.
Dr. John Pryor from Essentia Health said he is unsure if Essentia received the same letter St. Luke's received, but he maintains that the safety of staff and employees is the hospital's #1 priority.
To me, that really doesn't matter if we received it or not. We are working continuously every day, several times a day, on trying to be prepared for the current state and for the future state.
As demand increases and hospitals need more equipment, both hospitals say they are actively preparing for what's to come.
The federal government is really taking control of the usual supply chain. So what we used to work through, we can put in orders, but those orders are being commandeered by the feds.
But community support has helped.
We have received 4,000 N95 masks from the community and 1,000 handmade masks from the community. So I think that's just amazing.
The hospitals say they will continue to track what they have, what they've used, and what they need to ensure they have enough.
Our hearts and souls and minds are totally focused on this right now.
And as we just heard from Governor Walz a few minutes ago, that's a challenge all states and even countries are facing right now, is getting those supplies. Now, we will have that update from Wisconsin Governor Tony Evers momentarily. But meanwhile, the March unemployment numbers out today are underscoring the seismic scale of the coronavirus pandemic and the toll it has taken on the economy. ABC's Andrew Dimbert is in Washington with more.
New unemployment numbers rattling the U.S. economy in the wake of the coronavirus pandemic. The latest figures from the Bureau of Labor Statistics show 701,000 U.S. jobs were lost in March, and the unemployment rate rose to 4.4%, an increase of nearly a full percent from just a month ago. It's the first jobs decline since 2010, but financial analysts say the true picture is even worse, as most of the nearly 10 million people who filed unemployment claims in the past 2 weeks weren't included in today's report. Those record-high unemployment claims over the 2 weeks capturing headlines across the country. The hardest hit sector, hospitality and leisure, with nearly 500,000 job losses last month alone.
A lot of the restaurants we worked with started to close. A lot of the wineries we worked with started to close.
The layoffs leaving millions without not just income, but also health coverage in the midst of a global pandemic. Enrolling in Obamacare may be an option for some if they were laid off from their jobs and lost their health insurance coverage.
Now I'm being told by my insurance company that if I can't pay my premium, then I have to switch to Medicaid and lose all my benefits.
Cash from the federal government has been approved for business owners and families, but there are different timelines for how and when that money will be distributed. Treasury Secretary Steve Mnuchin says direct deposits could happen in 2 weeks, but a leaked memo obtained by ABC News shows paper checks could take months.
Again, if we have your information, you'll get it within 2 weeks. If you're Social Security, you'll get it very quickly after that. If we don't have your information, you'll have a simple web portal, you'll upload it. If we don't have that, we'll send you checks in the mail.
Meanwhile, mixed messages from the White House and top health officials. Dr. Anthony Fauci, one of the lead experts on the coronavirus task force, tells CNN he does not understand why the entire country is not under a stay-at-home order, stopping short of saying the Trump administration should mandate it.
But if you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
And now the mayors from the nation's two largest cities, New York and Los Angeles, are advising their residents to wear non-surgical masks when they go out. And the Trump administration says that it's considering guidelines that would advise all Americans to do the same. Andrew Dimbert, ABC News, Washington.
Thank you, Andrew. And as we continue to wait for Governor Tony Evers' update, a reminder to practice social distancing even while getting that much-needed fresh air. WDIO's Brandon Weathers explains what we need to know before heading outdoors.
Outdoor recreation is allowed and even encouraged under the stay-at-home mandate.
So absolutely get out and recreate. You want to maintain your physical and mental health.
But with more people stepping out for fresh air, some city and state parks have become overcrowded.
So what we'd really like people to do is exercise really good judgment and common sense here. If you pull into a state park and you see that it's very crowded, that's probably not the place to go. That is not in keeping with the governor's order.
The city of Duluth is trying to redirect the heavy traffic they've seen in certain areas around town, such as the Lake Walk. Some streets, like Seven Bridges Road, have been closed off for bike and pedestrian traffic only.
We are continuing to look at other opportunities to close roads, to continue to increase pedestrian and bike opportunities.
You may be seeing signs like this, providing examples of what 6 feet of distance looks like. If you're on a trail where you can't keep the length of a bicycle between yourself and people passing you, it may be time to find a new route. Officials say it's also important to keep your activities as close to home as possible.
This is not the time for you to be driving 100 miles away from home to go to your favorite state park. This is a time for you to stay close to home and enjoy what's near you.
To spend some time outside in nature is really important to our public health as a whole, so long as we can do it safely and respectfully of everyone.
Brandon Weathers reporting for us there. And we're still standing by for an update on Wisconsin's response to COVID-19 from Governor Tony Evers. It was scheduled for 1:30. While we all try to stay at home as much as possible, some have fired up the sewing machines to make masks for healthcare workers. I spoke with a St. Scholastica student who is one of them, and for her, it's personal. Amy Little would rather be at the hospital. She was until March 16th, doing rotations as she prepares for a career as a physician assistant.
I'm sitting here at home and I felt like I could be doing more.
But the St. Scholastica student was called off the job due to COVID-19 concerns. Sewing was already a hobby,
and her sister told her about people making masks for healthcare workers. So she found a pattern that Blue Cross Blue Shield posted online.
You can wash them, so it's almost like scrubs, how once they become soiled or day's end, you're not going to wear them anymore. You put them in the laundry, and hospitals will wash them.
She estimates that she's sewn about 100 masks so far.
Something so small, and yet that's 100 people maybe that you're helping.
She's delivered them to United Hospital in the Twin Cities and Essentia Health in Duluth. While she can't be there working with them, it's a comfort providing for the providers.
We all want to help, that's just the nature of why we go into healthcare. And it's helped me, especially because I want to be out there so bad, and yet I know I can't. I haven't graduated yet.
Her classmates that can't sew have found other ways to help, like picking up groceries for healthcare workers. And she says there's one thing we can all do.
Say thank you. That is really a huge thing.
Bailey Warfield for WDIO News.
And Wisconsin Governor Tony Eavers is now providing his update on the state's response to COVID-19. Let's go live to Madison.
Legal counsel for the governor's office. We will begin the briefing with remarks from Governor Tony Eavers.
Thank you for joining us today. I want to begin by thanking all of you for doing your part to prevent the spread of COVID-19. Your efforts to maintain social distancing, the sacrifices you have made when it's come to your jobs, your schooling, and your day-to-day activities are what we need to flatten the curve to protect the people of our state. It's also what we need to do to support our healthcare workers who are making heroic efforts to test, treat, and prevent this virus. At the same time, we've also had to be patient with each other and ourselves because we're all doing this for the very first time. And there's bound to be some glitches along the way. We must remember that at the end of the day, we're all doing our best and we're all trying to do the right thing. And one of those glitches along the way has been the upcoming election. Folks, there's no real good answer to this. It's not an easy situation, and frankly, no one wishes this was easy as much as I do. This is, as I've said, a rapidly evolving situation. I've said that I would listen to the advice of the public health experts. I said I would let science be our guide, and we are. But as we've faced these challenges over the past few weeks, I have also asked the people of our state to do their part to help. Well, here's the bottom line, folks. If, as elected officials, we're going to expect the people of our state to make sacrifices to keep all of us safe, then, by golly, we better be willing to do our part too. So today I announce that I'm calling the legislature into special session to do its part, just as all of us are, to help keep our neighbors, our families, and our communities safe. Folks, I can't do this or move this election or change it on my own. My hands are tied. And that's why I spoke to the legislative leaders about this weeks ago. I even publicly called on them to act. They have made it clear they are unwilling to change. I was hopeful that the courts would help intervene in this issue. All the while, I've moved ahead making plans for the election. I've called up the National Guard to help meet staffing needs at polls across our state. I've worked to provide PPE, cleaning supplies, hand sanitizer, and pens for every polling location. The bottom line is that I can't ignore that municipal leaders from Green Bay to Milwaukee to Waukesha significantly condensed the number of polling locations available, creating a dangerous situation where voters, staff, and volunteers will not be able to avoid large groups or practice social distancing when they go out to vote. This is a significant concern and a very unnecessary public health risk. I'm hoping that the legislature will convene and take up a special session tomorrow for an up or down vote to send a ballot to every registered voter by May 19th who hasn't already requested one, and to extend the time for those ballots to be received to May 26th. It's time for the legislature to do its part, just like all of us are, to help keep each other safe. And in addition to announcing the special session today, I am also announcing another important initiative. All of this, I know, has caused considerable stress on everyone. For some, it has increased our anxiety and has led to depression. That is why today I'm announcing Resilient Wisconsin. And while Resilient Wisconsin will be an ongoing initiative, we cannot think of a more important time to launch this website and resources designed to connect and build resiliency for Wisconsinites affected by trauma, toxic stress, and other mental and behavioral challenges. My first teaching job was teaching science in Baraboo. Did you know that resilience is actually a science term? It comes from physics, and it refers to the ability of a material to absorb and then release energy to return to its original shape. But for us today, as we face the ongoing challenges of COVID-19 in Wisconsin, resilience is how we will band together and grow as a state in the face of unprecedented times. Resilience is our ability to recover from adversity. It's our ability to adjust to change, and it's our ability to deal with difficulties. Resilience does not mean you don't experience stress. It means you're using tools to be kind to and take good care of yourself and stay connected with folks around you, all to help to reduce your stress. And being resilient doesn't have to mean being alone. Supportive relationships keep us grounded, and while physical distancing might make maintaining that connection harder, it also makes it even more important. Even in this time of physical distancing, we all need to remember the importance of the human connection. And to our first responders and healthcare professionals who we know are experiencing the stress on the front lines of the pandemic, let me say this: we are here for you and we see you. As we work to flatten the curve, we see your dedication. We know the work you're putting in to keep us safe. And we know surely it must be exhausting. And you know what, folks? It's okay for heroes to ask for help too. That's what resilience is all about. All of us learning it's okay to lean on and depend on each other during the worst of times. I've used the word resilience a lot today. That's because that is what Wisconsin is. And is who we are. It is true that COVID-19 is a new challenge and that it has brought significant change to our lives. But what I also know about this state is, having spending most of my life here, Wisconsin is resilient. You are resilient. We are more resilient together, and resilience is the way forward. So thank you so much, and I'll now turn it over to Secretary Designee Andrea Powell.
Thank you, Governor Eavers. Good afternoon, and thank you all again for joining us here today. I know I usually start with the numbers, and those numbers are important, and I'll circle back to them, but I want to take a moment to talk about some different numbers. I want to talk about the thousands of first responders and medical professionals and clinic support staff on the front lines of COVID-19. I want to talk about the thousands of teachers doing their best to continue educating and supporting our children through this difficult time. Thanks as well to the grocery clerks and gas station attendants and warehouse workers and delivery drivers. A big debt of gratitude belongs to the millions of Wisconsin residents protecting each other by following Safer at Home, because we know that flattening the curve is how we save lives. And I want to acknowledge those of you worried about loved ones who are sick with COVID-19 and to honor those who are grieving loved ones who have passed away. This is all difficult work, and I want to acknowledge and thank you for that work. Staying safer at home is so important, but we know that it isn't easy. We want to make sure you have the tools to care for yourself, to stay connected, and to reduce stress when possible. And our website, resilient.wisconsin.gov, provides information on these tools and additional resources to explore about caring for yourself, about staying connected, and about reducing your stress. It may seem selfish to prioritize your own needs at a time like this, but in reality, it's not selfish, it's self-care. We need that self-care to deal with our stress and make it possible to care for others around us and stay connected. Supportive relationships keep us grounded, and physical distancing can make maintaining that connection harder. It also makes it even more important. We can't change our current reality, but we can change how we react to that stress. One of the most effective ways to reduce stress is to reduce your risk of infection. Wash your hands for at least 20 seconds. Use soap and water. Cover your coughs and sneezes. When you leave your home for essential trips to the grocery store or pharmacy, please remember to stay 6 feet apart from others. And remember, you are safer at home. Knowing that you are doing all you can to flatten the curve in our state can help relieve some of that worry. But sometimes these strategies aren't enough, and we want you to know that it's okay to ask for help. We know that feelings of isolation, economic hardship, or fear of getting sick, that all of these can pile up and make us feel overwhelmed, anxious, or depressed. Telling someone about these feelings isn't a sign of weakness. It can be a necessary tool to survive in this ever-changing situation. So I encourage everyone to visit resilient.wisconsin.gov to find the resources you need to build resilience and bounce back from this tremendous disruption in all of our lives. I now want to turn back to the numbers that I usually start with. So today, we have 22,377 negative tests in Wisconsin, 1,916 positive tests, and 37 deaths from COVID-19. Of those 6 new deaths, 1 is a male in Dane County in his 80s, 3 are Milwaukee County residents, a female in her 70s, a male in his 70s, and a female in her 80s. And the final 2 new deaths today are in Ozaukee County, a male in his 70s and a female in her 90s. Today, we have 2 additional counties reporting cases for the first time, Rusk and Barron. Our hearts are with the loved ones of the people who have passed, as we have said many times, and I know that you certainly share that sentiment. And we wish for those who have been diagnosed with COVID-19 a quick recovery. In all areas of public health, data is an important tool, and the numbers do tell us a story. This week, we added new information to our COVID-19 data webpage. In addition to case counts and case counts by county, we're now providing the number of hospitalizations, cases by date, and the cumulative total cases by date that have been confirmed. Keep watching, there is more to come. But collecting and disseminating data isn't as easy as 1, 2, 3. Our data team reviews each piece of information we collect for accuracy. And although it is a thorough process, when it comes to being transparent and providing you a true picture of that situation, it is important that we get it right. We look forward to bringing you more information as we continue to analyze and collect data on this pandemic and its effects on Wisconsin. As a final note, I want to point out that next week is Public Health Week. So I want to take this opportunity to acknowledge our local and tribal health officers who, like our healthcare providers, have been on the front lines since day one. You are true partners, and we could not respond to this pandemic without you. Finally, while the numbers may not seem like you're making a difference, believe me, you are. Please continue to remain patient and stay safer at home. With everyone doing their part, we will bounce back from this pandemic. Thank you.
Thank you. And we'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And for the sake of time, we also want to remind you that we are taking 1 question per reporter per outlet. And we'll begin today with Sean Kirkby from Wisconsin Health News. Sean?
You've been watching a live update from Wisconsin Governor Tony Eavers. We are continuing to carry that question and answer session on our website and mobile app. We'll also be carrying a Q&A with Governor Tim Walz and other Minnesota leaders after 2 o'clock on our digital platforms. And of course, we'll have a full recap of today's developments on WDIO News at 5, 6, and 10. See you then.
This has been a WDIO News special report.